Dr. Baars and Terruwe often spoke of the clients being cooperative in therapy. How does such cooperation or lack of it affect the client's prognosis?
Well, here we're getting into the area of resistance. It is normal and natural for any client to put up a certain resistance to therapy because therapy leads the client to the truth, and the truth is often painful, and our nature is fallen human nature is to seek pleasure and avoid pain. I'm particularly talking about the repressive neuroses, where we must remember that those kinds of neuroses are essentially defense mechanisms. We don't want to deal with painful reality. We don't want to deal with painful memories. We don't want to deal with painful emotions. We don't trust our emotions. We're afraid of our emotions. And emotions might start coming out, and the person balks, the person resists, doesn't want to continue therapy, or doesn't want to deal with his problems. So some resistance is always going to be there. Resistance can get to be a problem. It can actually jeopardize the therapy. As you notice, like you had said, in the case studies, most of the, if not all of the case studies presented in the book, there was a lot of cooperation. There was a minimal of resistance. The people were very eager to obey the therapist, to embrace the principles, to understand the principles, to apply the principles. These are ideal situations, and these are what we call garden variety clients. But unfortunately, not all clients react or act in therapy in such a congenial way. One form of resistance would be simply denial. I have a client comes in with a presenting problem, say for example sexual impotence, and the client says, well, I'm sexually impotent, and that's my problem, but I'm not going to talk about my childhood, or I'm not going to blame anybody else. I don't have any problems other than this impotence. And the client refuses to acknowledge some of the real roots of these problems. Another form of denial would be not applying the principles. You tell a client to learn to be more, slow down his pace, stop intellectualizing, leap before he looks. Well, the client says, yeah, okay, but the client has been in therapy, say, for 2 years, and the client hasn't done any of that. That's a form of resistance. Another form could be passive aggressive. The client is angry at you. The client transfers feelings toward, say, his father onto you, and so he starts to take out his anger on you. And in order to hurt you, to punish you, maybe you said something that triggered something in him, he'll show up late for his appointments. He'll happen to forget his checkbook. Little tricks that clients will have in order to frustrate the therapist. Another form of resistance would be where the client tries to control the therapy, tries to control the therapist. The client comes to demand certain things, to question, to probe the therapist, to try to set the therapist off balance, try to undermine the confidence of the therapist. I mean, it's amazing what clients will try to do to offset the therapy. Again, because they're frightened, they are afraid of what is underneath, what is being repressed, and they're using every means they can to resist that, to resist those scary emotions, those scary memories. So there's a lot to contend with when we're dealing with clients.